Hello, I am Dr. Sumit Goyal. I am Head of Neurointervention and Senior Consultant Neurosurgery at PSRI Hospital, Saket, New Delhi. Today we are talking about brain death. Brain death is a condition where the brain functions have come to a complete halt, or the brain has completely ceased to function. We also call this technically as a brainstem death. That is, the brainstem is an area of the brain which control all the important functions, including respiration. So when this functions comes to an halt, when the brain stops working, the sustenance of life is dependent upon life support systems, on ventilator and other life support measures. Now this is a situation when the brain has suffered an extensive damage, which can occur in cases of head injury, brain hemorrhage, lack of oxygenation to the brain like drowning, carbon monoxide poisoning, stroke, or a heart attack or cardiac arrest. Coming to cardiac arrest, this is a situation where the heart has stopped functioning, maybe for the time being when it is being revived. So during that time, the oxygen to the brain is not, the oxygen to the brain is hampered. The supply of blood to the brain as to the rest of the organs are hampered. Now brain cells are very sensitive. They require oxygen every second to continue working smoothly. Now the moment this supply is hampered, the functioning of the brain cells start hampering at the cellular level. So in next 3 to 4 minutes, the brain cells start dying, and if this supply is not restored well on time, the brain would suffer damages, quite a bit of which can be permanent, and if they are extensive, they may lead to brain death. There is a difference between a comatose state and a brain dead state. In a comatose state, the patient might not be awake or may not be aware of the surroundings, or may have paralysis, or may not be having movement in the limb, but still he may have his own respiration. The brain would still be working to maintain the vital function needed to sustain the body. While a brain death is a condition where all these functions are completely lost. So brain death is a condition where reversal to normalcy is not possible. The confirmation of brain death is done by certain tests which are to be conducted by a neurologist, neurosurgeon, or a critical care team. And this is a situation where if unfortunately somebody lands up into a brain dead situation, we have to discuss the options with the treating surgeon or the critical care people to discuss how do we proceed ahead. It is a difficult situation, but then a complete understanding of brain death situation would help us to make it would help us to decide how to proceed ahead. Thank you.